So my name is Anthony Blackburn. I am the Communicable Disease Outreach Nurse for Prince Edward Grand Council. I think the biggest goal would be to bring our health to them, to communities themselves, rather than having such a far distance to travel. I think we've had really positive feedback to show that this van has already been quite successful. A couple times we've turned already to some communities, and instantly they know what we're there for, who we are, and it's excitement. They get to see us come in. The kids know us. A lot of the elders and community members and clinic members kind of know what we're doing when we come into town, and that's the whole idea. So lots of room, lots of headroom in here. I'm not the tallest guy in the world, but it's plenty of room. We've got our exam bed, refrigerator. We do have our toilet under here. Lots of shelving for extra stuff, and this is all shelving. Not labeled at the moment because we change up what we're bringing to different areas. We have the battery system always set up, ready to go, and our inverter system. And everything's been really good. We haven't had any issues with any of these. And we kind of made a checklist for people, if it's not me driving, to kind of go over everything so they know what they're talking about. All the drawers, there's no problems with them. The big magnets stay in place. We've never had a drawer open, even on the world's worst roads. And that's been dramatic compared to some campers I've been in where the things are flying everywhere. The way we came up with the design was kind of bouncing ideas off of what we needed and the professional advice they gave us of what they could do. Everything's portable, so we don't have an issue with any freeze up. We bring things in and out as we go. It's got a little heater in there. It's a little warmer lately. We haven't needed to have the heater on. Lots of lighting, privacy, easy to clean, slides everywhere. The temperature's been great in here. And there's enough room to move around with up to 3 people in here. We haven't had any issues at all. I think it worked out really well because I got to be a big part of developing and designing what I thought would work, and they put it together, as simple as that. We kind of ideally have it set for like 3 people, 2 people working, like 2 nurses working, and a patient one at a time, because it is a private. It's through health. We're doing health, so our confidentiality is always most important with the patient. Now that we're actually out in communities, we've been using this van for a couple months. It's been exceptional. The greeting we have in communities, there's a lot of curiosity. There's a lot of coming to see what we're about, and that was our main goal, just to get people used to what we're doing, and then to use that into a type of portable clinic is perfect, because sometimes there's not the room in communities to set up, so we pull in, we set up right wherever we are, and it's been great so far. The traveling itself to get to these communities can be very difficult. Paved To Pines has really helped us come up with a great idea to have the 4-wheel drive system, the off-road capability. Everything about it has been perfect.